So happy Monday, everyone, and thank you so much for joining us with this virtual learning. So we're talking about treating acne with BiON. And you'll find that this PowerPoint, it's a little lengthy in the beginning. It's going to feel like I'm reading you a little bit of a story. But please bear with the first few slides. It is important information, but this will be recorded and you will have a copy of it. So if you feel like there's a lot of information, just know you can always go back and reference it. It's not something you have to absorb right now today. But what I'd like us to do during this is I do want it to be very interactive where you're asking questions. You can put them in the chat box at any point, and I will scope over and look. I have it open just so I can see what's going on in there. But I want us to go into our little esthetician toolbox and pull out our little critical thinking skills, because I think when it comes to acne, we really have to hone in on not the normal, how am I going to treat this by a protocol? And yes, we all love a protocol and we're all thankful that we have protocols because they help us get on the path that we need to go in terms of what conditions we're treating. But everyone's different, everyone's skin is different. So we have to learn how to treat acne by also using our little critical thinking skills and how do we pick the products. And this webinar is going to have a lot of information on acne, and you won't see a lot of product in it. So if you're not familiar with product, just make sure you have a pencil so you can write down what products we're talking about, but we'll talk a lot about products. Let's see here. Oh, my little laser. I'm going to have way too much fun with that, by the way. I found this earlier when I was looking through here. So Alexander's Aesthetics is a wholesale distributor. Wendy was on with us earlier, and she's the owner of the California office, or I'm sorry, Colorado office, and her mom owns the California office. So we carry a lot of great supplies. There's Wendy. And if she wants to talk a little bit about Alexander, she can. But, oh, sorry, I just saw this in the chat box. Elizabeth has never heard of BiON. Well, I'm very excited that you are here. So we carry wax supplies, skincare supplies, lash and brow products for lifting and tinting. We have disposables and tools. We have PPE and sugaring supplies. We offer online education like this. We also offer in person at our California location and our Colorado location. We do have on-demand classes, and we currently have a free BiON product knowledge, which goes through all of the products. So the product that we talk about today, plus the rest of the line, and then support for all of our carried products. So if you purchase something, you don't know how to use it, you can call us. Everyone on staff is an esthetician, and we can help and guide you through. We want you to be successful with your products. We do drop shipping, and we have curbside pickup available as well. And then right here is our Instagram. So if you don't follow us, we would love to follow your journey, and we'll check on it after this webinar. And if you followed us, we'll follow you back so we can support each other. Plus, we just love to see your results and before and afters and everything like that. My name's Trini. I've been an esthetician for a while. I am a current esthetician in a treatment room. I use BiON every day, either at home or in my treatment room. I'm an educator and an on-staff esthetician at Alexander's Aesthetics. I love BiON, just throwing it out there. I've had amazing results with my acne clients and also my anti-aging clients. So it is something I truly do love and believe in that will help and work. So know that when we go through this information, all these products I've touched, used, and have been working with for quite a while. So on our agenda today, we have the formation of acne, and this is the section that's going to kind of feel like I'm reading you a book, but bear with it. Try to visualize the information as much as possible. The different types of acne, the causes of acne, acne triggers, and then question and answering. And we'll discuss BiON products as we go throughout the webinar. So before we move on, I do want to talk a little bit about BiON and the line itself. So for anyone who doesn't know, BiON actually started as an acne line. And they are different from other acne lines because they don't use benzoyl peroxide in their products, which is a popular product. But BiON's theory is that they want to treat the not the symptoms of acne, so not what's going on, but the cause of acne. And to do that, they use a different route of ingredients. They're not super heavy on salicylic. It's all very controlled product and ingredients. So it is a little different. Later on, they branched out and now they have a very large line of a lot of different products, but their acne was the beginning. And just a little side note, their anti-aging and other products, phenomenal. And they work really well with BiON's acne products. So BiON does have special cleansers for acne, and they do it in a really special way. I think I would consider it very special. They have oily products for oily acne and products for dry acne, which I think is sometimes where we go um, wrong when we're trying to figure out how to treat it. We're treating some people for oily acne when they actually have dry acne. So let's get into the nitty gritty here about acne. So biochemically speaking, acne is easy to understand. To me, acne is never easy to understand. It makes me so mad. Like right now, I have a pimple and I'm like, I baby my skin. I get facials. I buy such good product. I literally live my life around taking care of my skin. I drink water. I try so hard and I still get something. So I think that acne is so hard to really grasp, but it is something that we just have to learn to work with in different ways because everyone's skin is so different. So testosterone is an androgen hormone which targets the skin and sebaceous gland. So if we look here, I'm going to grab my little pointer out. This is our sebaceous gland. And when testosterone combines with the enzyme 5-alpha reducitase, this is an important word, so this is something we need to remember. It produces another hormone called dihydrotestosterone, which stimulates the sebaceous gland to produce an increased volume of sebum. The sebum is expelled out of the follicle tube, so right here. P. acnes and other bacteria on the skin and within the follicles produce bacterial lipases, which are enzymes, that move into the follicle opening and convert the sebum into a fatty acid. The fatty acid is what irritates the follicle lining. So like right here in this little lining. So when we think about this, to just break it down, there's bacteria on the skin. When we have the P. acnes, they cause irritation into the skin. Now, when we talk about this, please know a lot of this does focus on cystic acne, but it does relate to all other acnes as well. The irritation that was being caused to the follicle lining causes an excessive production of cells and cellular debris, which then blocks the follicles and traps the P. acne. So that happens right around here. The P. acne bacteria inside the blocked follicles breed and produce more of a cystic acne infection situation. The infections grow and they inflame the skin, and the microphage cells produce inflammatory histamine that cause the skin to become red, painful, and puffy. So that's where we start seeing those really irritated cystic acne, or sometimes this can just be with regular acne. This causes more follicle blockage and promotes more cystic acne infections because they are so deep. This is happening at a very deep level within the skin. And so when we have that and they're breeding and causing more, it's causing it almost like a series. So I feel like with cystic acne, it's not super often that we just see like one, by itself. You can see that there's usually like more. The infections are very deep in the follicles, and the acne infections might not rise to the surface of the skin. and it cannot be expelled. And that's what causes it to be so painful and uncomfortable. And you can't pop it because it is so deep. This causes the healing process with cystic acne to be slow. And that's why we really have to figure out how do we um, treat this. So a lot of BiON's products actually target that 5-alpha reducitase process where it combines with the testosterone. I'm going to have so many issues saying testosterone today for some reason. Okay, so that's how generally acne is formed. Can it be caused other ways? Of course. But this is one of the bigger things. Sorry, if I'm looking at this direction a lot, it's because I have my notes and the camera over here in the chat box. So on my second screen. We have different types of acne. Before we go, somebody type in the chat box if you know what types of acne there are. At least give me 2 different types of acne before we go on. We've talked about one, so I've already given you one, so give me another one. Mild, okay, yes. Inflamed and non-inflamed, perfect. Do we know names for those? Oh, we got good answers here. Okay, so pustules, papules, and comedones. Great. Okay, awesome. So the first one we're going to talk about is acne vulgaris. So acne vulgaris, ooh, this little laser is going to be way too much for me to handle. I'll take my hand off this. Acne vulgaris is, I think, what we see very commonly, especially teen acne. I feel like a lot of the young adults that I treat that are in their like early 20s have a lot of this going on. And acne vulgaris is infections that rise to papules. So they're the pus-filled pimples, or whiteheads, and they're on the surface of the skin. They usually discharge white pus when squeezed. Blackheads, cysts, and papules, which are the little red spots, may be present, and it occurs on the face, upper and lower back, chin, and then also you see it sometimes, on people's butts or thighs, they get this. But some cystic acne conditions may occur with this as well, but usually it's by itself, and it's more like a whitehead or blackhead type situation. So how would we treat this, and what BiON products would we use? So let's talk about this. When we look at acne going on, what do we see a lot of here? And I want you to answer these questions in the chat box. So what are we looking for when we look at someone who comes in with this type of acne? Anyone? So when I look at someone who comes in with acne, I always look to see, are they inflamed? And most of the time is yes, right? Where's the redness? Are they truly dry? What size are their pores? What is the condition of their skin? Um, and I always want to ask, well, what are you using now? So I feel like this acne is one of my favorite types to see when somebody comes in with it, because I'm like, I know how to work with this. I can do this. I can clear this up. Because sometimes this type of acne is really based on like overuse of products. So when I say that, people are using like a zillion actives in there, like, oh my God, I use a salicylic cleanser, and then I use a salicylic scrub, and then I use a glycolic pad, and then I go in and I do a moisturizer that has salicylic in it again, and then I do that morning and night, and I'm also putting this mysterious cream on from Amazon that has a lot of actives in it, and I wanted to use a retinol, and I heard that this will help. We've all heard it, right? And when that happens, I like to stop and hone in. So sometimes this can even be fixed with just a very basic cleanser. So I usually start them on the cleanser for normal skin, and then I'll send them home with the appropriate acne cleanser. So BiON's acne cleansers are the antibacterial cleanser and the Bactrostat cleanser. The Bactrostat cleanser is easy to pinpoint because it's like a yellow color because it has turmeric in it, which really helps subside the inflammation. So it's very good for inflamed skin, but also acne, rosacea. And I have them rotate. So I actually would tell them, how about the first week you just start with the cleanser for normal skin? What's this going to tell me immediately? It's going to tell me if they're really cleansing their skin or if they needed to come off of maybe some of those actives because they're stripping and their skin doesn't have that pH balance that it needs. So I actually have them like back up a little bit and then just go on a normal cleanser. Um, I'll have them come in about a week and then we'll reevaluate their skin. I'll put them on a acne safe moisturizer. So with BiON, most of theirs are, but I'll usually start them on their moisture complex and just give them very minimal. So with acne, I work a little differently. I don't like to go super aggressive right away. So I'll go normal cleanser, a toner, and that toner may have an active in it. So it might be the Mandelic toner pads or just their refreshing toner spray. And then I'll add in um, the moisturizer. Then they come back and we can do, if we didn't do a facial the first visit, which I usually do my consultation, on their next visit, we'll do a facial. At that time, I can say, okay, I feel a little bit better about putting an enzyme on your skin because I know you're using stuff at home. So if you want to get a little bit more aggressive, if you notice when they've come back, they're still having quite a bit of breakouts, we can use the inhibiting gel from BiON once a day, and you would use it in the evening after a cleanser. So once again, that cleanser can be an acne cleanser or it can be um, the cleanser for normal skin. Now, the cleanser we wouldn't want to use on this would be like their mineral cream cleanser, which is too thick, too creamy for acne. And we wouldn't really want to use their cream other cleanser. Now, I'm sorry, the mineral cream cleanser is actually a clay base, and then they have a cleanser for gentle skin. And I need to look at the full name of this. I don't know how I forgot it, but those ones are just a little too thick. So acne vulgaris is honestly one of the most common types of acne. You'll see it in youth, especially during puberty. It does affect like 85% of adolescents and young adults, and up to 40 to 50% of individuals that are older than 25, which we see all the time. So gentle cream cleanser, there we go. That's the other one we don't want to use for acne. The other products that we can consider if they are still really struggling um, to minimize that redness and inflammation would be the follicle clearing lotion um, or the green tea poultice. So if you haven't heard of the green tea poultice from BiON, this is a must-buy product, even if you don't have a ton of acne. It's a metronolinite clay base, and so it's green. But you get a little bit of it on, and you can spot treat with it. If someone is really struggling with a lot of redness, you can have them apply all over their face as a mask at home. You can use it in your treatment as a mask at home, and it works really well. So let's talk about, since we're talking about in treatment room, what would we maybe consider for someone with acne vulgaris when they come into the treatment room? So BiON has fantastic enzymes. Now, maybe we want to make sure that their skin is prepped and primed before we move to an enzyme. So we may not go right to that might not go that direction right away. But we want to build up to it. So we might just do a very regular facial that's going to help us see how the skin reacts. If we can minimize the acne with that, And also if they're going to comply in their program, because if they're not, it's very difficult for us to help treat. I also want to make sure that they're wearing sunscreen after. The beautiful thing about BiON's SPF is that it is a moisturizer because its base is the moisture complex. Then it has the added zinc and nano size zinc in it. So you can have them use that as a moisturizer, but I just want to make sure they're using SPF as well. So to treat in the treatment room, I usually reach for the, I'm having a brain block today and I'm so sorry. The mango papaya enzyme and let me look really quick. I have it pulled up because I was like, just in case my mind tricks me today. Let's see. Oops. I want to give you the full correct name. I'm sorry. Pineapple mango enzyme is their acne enzyme, and it's great. It's for normal to oily skin types, and it can be for problematic. Also, the pomegranate papaya is one of my go-tos, and it's so wonderful. It has, let me just, pH of 3.2, and it is the enzyme from BiON that has pumpkin in it, and of course the bromelain in papain. So that one I have found a lot of success with as well. Oops. Okay. So cystic acne, which I think this acne I definitely get a little bit more nervous when I see because I know it's more difficult, but I also really like to start at the same point where I'm stripping back some products. I do like to start going in with a exfoliant though right away, so a more active product. So the Mandelic toner pads would be great for starting with this particular type of client. The inhibiting gel from BiON would be used once a day in the evening after a cleanser, or post inhibiting gel, which has a great property to stop um, stop stop production of that 5 alpha reducitase before it continues. So it'll help subside a little bit. And then also, if they're more on the oil prone side, we can use salicylic or the salicylic glycolic gel as well. And then of course our green tea poultice. So with cystic acne, I would go in more with the bacteriostat because it's going to help with that inflammation and soothing the skin. They haven't, their other cleanser is called antibacterial cleanser. It has a little bit more salicylic in it, and it is for your true oil prone skin. I live in Colorado, and I think it's a little hard for us to be oily here. It's just too dry. So I always am on the side of caution when using that. If you're in a more humid place, and you have clients that have that true oil prone skin, then the antibacterial would be fantastic. But I would start cystic acne for sure with the Bactrostat or even a glycolic cleanser, because as we read earlier in those beginning slides, what's happening there is that formation of all of those dead skin cells are blocking the follicle. So now things are really deep. So we have to start working on breaking them down and exfoliating the skin so things can start to come up. But it is important for us to remember that we want to start to soothe the skin, take down the inflammation, and also rebuild the barrier. Because when you look here at this picture, you can even see, the barrier is so distressed. There's a lot going on and it's painful and uncomfortable. And a lot of times when we can get the barrier at the right pH, then we can start working on getting the acne down. I usually think when I go to look at products for acne, I immediately start to think, let's get the inflammation and the redness down, and then we can target the acne. So I once again would definitely put in the cleanser for normal skin for this particular client. And then I would probably be more on the side of glycolic at first, just to have them rotating back and forth, and then add in. BiON also does have two small kits, and they start with, I'm sorry, they are the dry acne kit and the oil acne kit, and they have different products in them. So this could also be something you give them to go home with, but I would tell them, okay, let's make sure you're doing an alternative cleanser as well, something that doesn't have an active. So deep cystic acne infections that are more cyst-like and nodule, they become large. Cystic acne infections do not rise to the surface and do not discharge their infection waste material. You can have blackheads or whiteheads and even milia, which I think milia to me would be more present than the other, just because, we are having that issue of the keratinocytes not being able to come up. But so they may or may not be present. Acne infections heal very slow, and the scarring is very possible with cystic acne. So just think about in the treatment room how we would do this now. So what I'm just very curious. I love asking questions. And I want to know, what would you do with a cystic acne client after you've got their skin ready? What would maybe be your first active treatment in your treatment room? Would you do an enzyme, a chemical pill? What treatment would you do? Salicylic, great. An enzyme, perfect. So I would say, yeah, I would be more on that side. I would definitely do an enzyme, or an enzyme with salicylic for sure. So enzymes are a really great tool for us because they're not super aggressive, and we can start slow. And once again, that helps us see how does our client skin react in the treatment room, and then also how is their skin acting, a week after to 2 weeks after. I feel like my clients tell me when they come in with really, really bad acne and their um, skin is on its little healing journey, they're like, I get acne, but it's going away so much quicker. And I do believe that is because of the enzymes that we do in our treatment room. The enzyme that I would once again go back to is the pomegranate papaya enzyme. I think the pumpkin is really helpful, and it also helps to, um, in helps with the antioxidants. Sorry, there's a lot of ingredient words that are just like firing in my brain all at once. So I'm like, wait, that's not the right word. Um, we want to give antioxidants because we want to really protect the skin, as well as um, working with the acne, but we want to put back in the skin because we are taking it out when we do enzymes as well, because we're asking it to exfoliate. So we need to support that exfoliation process as well. And then, of course, the pineapple mango would be a great one. The pineapple mango has a higher pH of 5.5. It does have salicylic in it. It's great for your normal to oily acne, and it's high in vitamin C. Has 6 ingredients in it. Also has grapefruit, so just make sure that if your client has a citrus allergy, you're not using this particular product. But one of the other products that would be fantastic to start with would be the pumpkin enzyme, which is one of my favorite enzymes from BiON. Its pH is 5.0. has that natural exfoliation, does have cinnamon oil and clove, so it smells really good. It has vitamin A and vitamin E, which help the cellular turnover as well. So definitely any of the three enzymes from BiON would be good. I think that the pumpkin enzyme would be a great place to start because it's not super active and it is a good test point. But let's talk about if our client had been coming to us for maybe this is they've had three enzymes prior, what would then be our next move? Because when we work with acne clients, it's not a one and done, right? We are consistently working with them. So what would be maybe the next move? We've seen some improvement with this particular client. Their inflammation is further down, and we're feeling like we're able to do something a little bit more aggressive. What would be our next step in this treatment? What do you guys think? We have one answer in there. Any other things? Were you saying Shannon Mandela? There you go, Mandelic. I was like, is a mandolin that little guitar? You know, sound bowls perhaps, but um, totally get it. Mandelic, I think, would be a wonderful place to start. And actually, BiON has a new um, chemical pill. It's a Mandelic. That would be one of my first places to start, or a lactic, because I still want to get into the skin. We could definitely go the other direction and do more of a salicylic, I'm sorry, glycolic pill for sure. So their BiON's lactic chemical pill is 35% and their glycolic is 30. But I think if I was just working with this client, I would like to start with something a little bit more gentle. I'm not a super aggressive esthetician. I believe that progress is better than pushing your client skin so far that you actually cause more issues. So I don't want to be a part of the overstripping. I want to be able to gently help them exfoliate. The Mandelic is a 30%. It has a pH of 2.2, and then BiON's other two chemical pills have a pH of 2 as well. This is not only going to help with the acne, but also that collagen, which is going to help improve the scarring or to minimize the possible scarring. So this would be a great product to start incorporating. Just so that's one of our biggest fears with acne, right? Is we don't want to have scarring. So if we can start to work on that right away as well, that would be a really good one. So Mandelic would be a great place to start, I think, for this as well. If we're looking at glycolic and we're going a little bit more that direction, we would certainly have results, but I would be a little bit more cautious. Their glycolic pill can only be on the skin for 1 to 3 minutes, so we would just need to be cautious of that. And then asking a lot of questions when they are post-treatment. So I usually text a day or two, like, how's your skin? Any irritation? Anything like that. Okay. And if you guys have any questions, like I said, please just chime in. So we have adult acne prior to this. This is what's getting me all the time. But adult acne and juvenile acne involves infection generated by the same bacteria that's causing the other cystic and acne vulgaris. Skin conditions can be very different, requiring different forms of acne treatments. Factors that stimulate adult acne are frequently different than those involved with juvenile acne, acne vulgaris, cystic acne, blackheads, whiteheads, or milia. Because we're not going through puberty, our bodies are not changing the same, so they are a little bit different. Adult onset acne usually involves normal or combination skin or even dry or sensitive skin rather than oily skin that's typical of juvenile acne. And that's, we have different factors because of different things going on. And of course, a lot of times we can trigger acne. We'll go through acne triggers here in a bit, but um, this acne can be a little bit more difficult to treat because we really have to find what's causing it. And sometimes it can be, of course, hereditary and just part of our DNA to get this, or hormonal. Because I feel like hormonal acne really does fall under adult acne. But most acne products are developed for juvenile acne, right? They're made for those who are younger, and that's why we have the antibacterial cleanser, because it's really geared towards those who are oily acne. But then the Bactrostat, which is the yellow cleanser, would be better for our adult acne because it's going to be not working on the sebum overproduction, but more the bacteria and things that could be causing the acne in that 5-alpha reducitase process. So adult skin may not tolerate persistent use of acne treatments, and then that's like, the people who are putting consistent actives on their skin, these acne products, and then their skin is actually getting worse, getting more red, more irritated, more inflamed. So just kind of backing off of that. And sometimes it really is just our clients aren't washing their skin with the right product. They're using over-the-counter things. So adult acne to me is also one of those situations that come in and I'm like, whew, I can probably treat this pretty easily. Adult acne occurs in as much as 50% of women in their 20s and 35% of women in their 30s. So I feel like I definitely fall in there. And we see it every day, right? We're estheticians, so we totally know that this happens. We just want to make sure that when a client comes in with this type of adult acne, that we are not overexfoliating, because we do not want the skin to become more sensitive and more active, which would cause it to become more problematic. So what would be in our treatment room, what could we start doing with this? What would be a good treatment in our treatment room for this particular client? And also home care, what could we consider doing? Any thoughts? Once again, for me, if this is my client, hydration support. Yes, we want to hydrate the skin. So um, I always kind of start thinking like a lactic or enzymes with lactic in it, or products that really can add in moisture to the skin in their home care. So to me, I start thinking, ooh, okay, yeah, pure hydration serum would be phenomenal for this client. Also, you know, not just having an active cleanser, also incorporating, maybe that cleanser for normal skin, and then a toner, because a lot of these particular clients don't have a great barrier. So that transdermal water loss is occurring. So if we can support the skin with products that have hyaluronic in it, we're going to be better off. And you'll start to see that their skin will start to really clear, and the sensitivities are going to start to go away a little bit faster. So in my treatment room, I'm always thinking, ooh, okay, so maybe more of a product with lactic in it. And BiON does have a lactic chemical pill, which is on the more gentle side. You're not going to see like somebody shedding layers or anything with it. They're going to flake, but it's fantastic. And once again, a pH of 2.0. So it is a low pH, but it's not super intense. It's very, very, very good. And it supports the hydration support for sure. Okay, so acne rosacea. This one is always a little bit more difficult to treat, but it is treatable. And I think for sure, this would be a type of acne that I want to do some type of hydration support with. So I think what I learned in my time as an esthetician is I used to approach acne like a crazy lady. I wanted to just throw all of the acids at it because I was like, let's clear everything up. But one of the things that I found is I have such better results when I back up. And I know I keep saying this over and over again, but it's so important for us to understand we have to work on that inflammation and the redness and calming the skin because our pH when we have acne is off. So in the chat box, I want you guys to post what is the normal pH for skin. This is so important for us to know. And I didn't realize how important the pH understanding the pH of our skin is with every single thing we do, but it's so, so, so key. So, what is the normal range for pH? So, slightly acidic, yes. What is that number? Do we know? Shannon's got the first part. Someone come in. I know someone knows. Yes, 4.5 to 5 point. It's 4.5 to 5.4 or 5.5. So those are perfect answers. Good job. Um, we have to keep the barrier at this number. Why? The reason is um, if our if our skin becomes a little bit more alkalotic, so it's not going to like range up to, super, it's not going to come up to 7, which is neutral where water sits. But if it becomes a little bit more alkalotic, bacteria can live and do its thing, and it's just going and having a field day. It sets up a different environment. The skin is more acidic because it bacteria cannot live in an acidic environment. Do we want our skin super acidic? No, but we do want it to be slightly acidic, 4.5 to 5.4. And that number is going to really help us start to work on skin issues. So when we have a little bit more acne going on, our skin is a little bit more acidic because the environment is able to harvest bacteria. So we want to get it to a better pH where we can really work with the transdermal water loss. And once we get there, you'll start to see inflammation subsiding, redness subsiding, the acne clearing up. So acne rosacea is caused from vasodilation, which is our the blood cells opening, which creates an increased temperature of the skin, which can increase bacteria because it's making the skin a little bit more um, acidic, alkalotic. So we can use products like the antibacterial cleanser, or I'm sorry, using antibacterial, anti-inflammatory cleansers to reduce acne causing bacteria from the skin. They have their their bacteriostat, which is made for dry skin, but also for acne rosacea. So I would 100% have a different cleanser in there, especially when we're working with rosacea. So like the cleanser for normal skin, and just slowly start to incorporate an active because we want the pH to be at a great barrier where it can take the active and not flare up. So acne rosacea is difficult to treat because it involves the treatment of two different conditions. So some of the ingredients may be used in acne. Oh, some ingredients that are used in acne products are a little too irritating and inflaming. And the skin may be especially irritating, or it might be especially irritating to rosacea. Using acne products may cause a flare up, which is what we were just saying, and will aggravate the acne. So that's why I try to treat it with very simplistic products at first. So once again, going back to that toner, having a maybe oil-free moisturizer, which BiON has a great oil-free moisturizer, and then slowly bringing them in. What would we do professionally for this client if they came into our treatment room? What would be our method of um, uh, facial? What would we start to do? Any thoughts? So this is why I think it's so good to have webinars like this. We need to find a way to treat this, right? Because someone comes into our room, we're going to say, oh God, do I put an enzyme on this? Do I put a chemical pill on this? Do I exfoliate this? I'm not sure how to help them. To me, the answer is no. Um, in the chat box, we have calm down the skin first, then treat acne. Yes. So if someone comes in with this and they're like, I can't stand the acne, I'm going to tell them I understand, but we're going to treat something else first, and then we're going to come for the acne. So in my treatment, what I would do is a nice gentle cleanse, a toner, and then a lot of skin loving products. So I put a nice jelly mask on, and we carry fantastic jelly masks. The oatmeal and lavender would be a really nice one as long as they don't have a sensitivity reaction to the lavender. The 24 karat gold would be very nourishing for this as well. BiON has a lot of great products to soothe the skin as well. So even that green tea poultice mask would be really nice to start minimizing some of the inflammation that we have going on. Moisture Complex would be a great at-home cleanser, but then also sorry, I switched over to Moisture Complex because I was just thinking that, but in our treatment room, we could use cold globes, right? So I like to put a jelly mask on top of the hydrating jelly mask. So BiON has a pink mask. It's called Hydrating Jelly. I would put that on after I've done some work, which is cleansers and whatnot at first, and then lay over a jelly mask. Our brand is called BioFrance. And then cold globes over that mask would feel so good. So the reason I like to do it over a jelly mask is because do we want to take cold globes and put them on um, our acne rosacea client's skin, just straight to the skin? Any thoughts? No. Why? The reason we don't want to do that is because we don't want, we don't want to spread infection, or because clearly there are some open pustules here. If it was just that, we don't want to move it around. So once we see a lot of improvement in the skin and we're not seeing active acne, then sure, let's take those cold globes all over and they'll feel so good. But we don't want to spread it. So when somebody comes in and they're like, oh yeah, I've been trying to cold rub my face and everything, I'm like, okay, if you're going to do that at home, I want you to do it with a sheet mask on. And then, because if not, you're moving the bacteria all over the face and you're spreading it. And we don't want to do that in the treatment room. So putting a sheet or a hydrating jelly mask on and then going over the cool globes, you will 100% see a drop in inflammation. It feels so good for them, but it also just really soothes the skin. And then I'm going to go in with a really nice moisturizer. So what are ingredients that we look for in moisturizers when we're treating somebody with acne rosacea or we're trying to add in nutrients to the skin? Any thoughts and ideas? Niacinamide for sure. Um, I always go back to hyaluronic because it's so clean and I'm not going to really stress about it. Um, Flaring up the skin. We would want to stay away from more actives like vitamin A's for a little while, of course, especially with this until their skin is completely healed and we're, maybe working on scarring at some point. I would err on the side of doing any type of um, vitamin C's, and then maybe on later down the road, if their skin is a little bit more healed, we can go into Mandelic if their skin is able to tolerate. But at first, I'm really just going to start with ingredients that have a lot of skin loving ingredients. And the Pure Hydration would feel really comfortable to me, just keeping it very clean. The Pure Hydration Serum has only 4 ingredients, so it's very minimal, and it's not something I'm super concerned with causing a flare up. And then, of course, we have these dang little guys. So our blackheads and whiteheads, everybody has them. We all have issues with them. How do we get rid of them? Blackheads are a combination of oils, sebum, and cellular fragments that can be firm to hard. They're plugs within the hair follicles. They darken by being exposed to oxygen and dirt. They're an open comedone, and they can also sometimes look like hairs. They can be called a sebaceous filament. And you'll sometimes see those on people's nose, and it's not always hair. Sometimes it's the sebaceous filament. Whiteheads are a combination of oil, sebum, and cellular fragments that can be firm to hard. Are plugs within the hair follicles. They are usually closed from the skin surface by cellular debris at the follicle opening and closed with comedone. We're going to see this every day on every single person. There's just no one who can avoid it. But we can easily help treat this. So the Mentalic toner pads would be awesome for this. They can use them once a day in the morning or at night. If you're feeling like their skin's really resilient, and you can encourage them to use it more frequently, but I usually start everyone off pretty slow. The antibacterial cleanser or Bactrostat would be fine for this. I would just, if it's just very minimal, I would have them rotate in and out like every 2 days, or maybe just once at night. If they're having a breakup or a flare up, they can use a Bactrostat, or if they're, I would say antibacterial for just minimal things like this. I wouldn't really be pushing it. A glycolic cleanser, of course, is always great for anti-aging, so you can use that here as well. But you wouldn't really need to go super intense. You could also use the blackhead whitehead controller, which helps dissolve and control milia. It also helps to dissolve the sebum within the follicle. So those could definitely be options. The green tea clay poultice would 100% be something that you would want to consider here if you're spot treating. It does, like I said, break down that redness. And even if someone has like a bug bite or something like that, that would be a really nice treatment for that as well. And then let me see if there's anything else I would suggest. I think that would probably be it. I did want to just touch really quick, sorry, on the inhibiting gel for cystic acne or someone who has severe acne. And we were talking about hydrating support. The inhibiting gel would be something that we would really want to incorporate in their plans, because it has the addition of salicylic. So your client would probably benefit from that as well. Okay, so causes of acne. We all know that there are so many different causes, but sebum production, which we've been talking about, irritation and blockage to the follicles, the presence of P. acnes, and the degree to which skincare professionals can control the multi-factors of acne determines their success in treating acne. So this is just saying, how do we, it's really going back to that critical thinking. What are we doing in the treatment room? How are we treating each person? Because really each case is different, and how we get success will be different with each client. So what we do can also help with either causing a little bit more acne for stripping and derailing that a lipid barrier and acid mantle, or if we're improving it. So there can be follicular blockage, which is sebum creates a physical blockage in pockets, all of that within the follicles, and it acts like a little incubation chamber, and it develops into acne infections. Multi forms of bacteria within the follicles, because we have that bacterial lipase in there, and they convert into sebum, which then within the follicles, which then creates that fatty acid, which causes the inflammation to our follicle lining. Inflammation agents such as the interleukin 1 and 6, which is what happens when we're inflaming. And this is really just our body doing what it's supposed to do, but causes a little bit of havoc. So it is triggering our protection system in the body. So the white blood cells and everything that really falls within our, what is the word for it? Coming to me. It'll come. Our, not immune system, but like our white blood cells and such. The antihistamine are very much involved in this inflammation and hyperexfoliation process. P. acnes become trapped within the follicles, multiplying rapidly, causing and developing acne infections. Sebum production, which happens differently at different stages in life, but at puberty, males and females produce more testosterone, which, as we talked about at the beginning of this, targets the skin and sebaceous glands. The 5-alpha reducitase, which is the enzyme present in the skin, which targets the testosterone and then converts it into dihydrotestosterone, and dihydrotestosterone directly stimulates the sebaceous glands, and that's what causes excessive amounts of sebum. So when we think of all of this, it's really just a refresh from when we first talked about it and tying it back together. And, you know, there's causes, what types of acne, and then what's going on in the skin. So just kind of retouching on it. So bacteria, which are the P. acnes, are specific bacteria that cause acne infections. They also produce the different bacterial lipases, and they cause that sebum to the fatty acids. And P. acnes are natural irritants to the skin, and they cause and promote additional inflammation and hyperkeratinization, which is the buildup of dead skin cells. Now, hormonal factors and sebum. I struggle with hormonal acne quite a bit, so I understand this part. But puberty produces elevated levels of hormones and testosterone and natural occurring 5-alpha reducitase and dihydrotestosterone. Sorry, the words here. But when we're working with hormonal acne, it's difficult because we aren't able to control what's going on internally. We can only help we can only really help with that 5-alpha reducitase, which BiON has products that have blockers in it for this particular hormone or enzyme. So that's why they're so effective when it comes to these particular products. Of course, we're not able to stop the body from producing these different hormones that cause that, but we can help the inflammation. We can help calm the skin and soothe it. A goal in treating acne is to limit and block that 5-alpha reducitase. And once again, that's why BiON's products work so well, because we're not treating the symptoms. We are, but we're not just treating the symptoms. We're also treating the cause of acne. So acne triggers, diet, of course. If someone is like, wow, dairy really affects my skin, and then they're eating a bunch of cheese, then we know. Stress, hormones, skin habits. Skin habits, I think, are a big one for me when it comes to talking to my clients, because I give them a facial and immediately their fingers are on their face. And I'm like, no. Or when they're talking to me, they're touching, and I'm like, when did you wash your hands last? So, do you change your pillowcase every 3 days? Are you using your bath towel on your face? Are you using a new towel every day for your face? These are really small things that we can coach and talk about to really minimize and help their problems with acne. And that goes along with personal habits as well. And then medications and supplements. We're estheticians, we're not doctors, we're not nurses. We can't recommend, we can't prescribe, we can't distribute or give, but we can understand what they're on and see how we can work around it and help them as well. If you'd like to learn more about BiON products and go more in detail, this is a short webinar, so it is a little bit quicker. Um, it's hard to go into full detail, but you can go online, access the BiON on demand for free. You can learn at your own pace. It's fantastic. It has every product in it and it goes by category. So it's a really great opportunity for learning and it's free. So you'll go to our website and then education, go into the on demand platform and sign up, and you've got it right there. So if you have any questions about it, you can always email after. But if you have any questions now about the acne products, I'd love to go through that. We have time. It is 11:03. Um, but I have time if you have time. So, any questions, thoughts, anything we didn't go over that you want to talk about? Anything? Well, awesome. Um, you will be getting, oh, price points. Yes, that's a good question. So, BiON has really good price points. Are you talking about price points of the treatments or price points of the products? Price of products. Um, I don't know off of the top of my head what the cost of each product is. I feel like the cleansers range from, and I don't really know if you know what, maybe we shouldn't do this just because it's going on YouTube, but I can send you the link to the page so you can look, just because we want to keep the wholesale price, off of YouTube so that if you're selling products, they're not like, oh, you bought it for what? And you're selling it for what? Um, but retail, I know the products range from like $26 up to like I think 70 or 80 might be one of the more expensive serums. Um, but they definitely range in price. I think that is an excellent price point for the amount of product that you receive in each item. Um, you definitely get a lot, but let's talk about frequency of treatments as well. So for me, when I treat acne, I have them come in, we do a consultation. I send them home with home care because I need to know they're going to commit to having home care before I put any type of active on their skin, right? So I want to make sure that I'm not, um, they're coming in first time and I'm like, oh, let's throw an enzyme on you. I have no idea if they have any home care in place. So usually about a week. When they come in, I can do another evaluation, see how their skin's doing, and then I'll do like a enzyme or something. And then if they come in, I usually ask them, and it also depends on your client, because your client might be like, hey, I only can come in like every so many, months or whatever. But I usually tell them once a month. So I'll usually do like an enzyme the first month I see them, the second month, and then the third month. And then I suggest to them that we do a chemical peel series if it's appropriate for that particular client. And then I'll do a series of chemical pills with them. And usually I do like 3 weeks or 4 weeks as their package. And then at home, I retail them stuff to support that chemical pill at home. So that would be like their cleansers and toners and having a mandelic possibly in there, depending on their type of acne. And also, of course, if we want to do our hyaluronic, which I think we should for sure. And then, of course, our moisturizers and SPFs. Any other questions? Does the use of high frequency? I think so, yes. With the products. Yeah, so usually what I do is I'll do my full facial. If I'm doing extractions, which I love to spend a lot of time with, um, before I mask them. I usually do my extractions before I mask so that the mask can help calm the skin down after I've, really went in on it. Um, but right before I put the mask on, after I've dried the skin completely from doing the extractions, and also I usually like run a toner through there. after I do extractions, just so I'm not spreading bacteria everywhere. This would be a great time to bring in high frequency for sure. And it would be fine. Of course, you don't want to use it with the any products on the skin because you always want it to be dry with high frequency, but um, absolutely, high frequency would be great for any acne facial. Oh, and I also wanted to mention these products are fantastic for like chest acne, back acne. BiON also has a cleanser and a lotion, which are geared towards your acne clients. But the bacteriostat is really, really good for back acne, chest acne. When I do back facials, that's what I use most of the time is just BiON's acne lines. Also, if they get those little KP bumps back here, you can use the bacteriostat on that. Like I said, I have a lot of people come in with like butt acne and they're just like, I really want this to clear up before summer. The Bactrostat is fantastic for that as well. And also if they get like more like ingrown type situation, you can use the inhibiting gel and the green tea poultice as well. So those are other options. Do they have almonds in that? They have almonds in them. They do. So some of the products do, and some of them do not. So let me look here. I have my little reference page. And also in BiON's product manual, you'll find that they have a like page that has what ingredients are in what products. So sorry, I'm just going through. I'm pretty sure it might just be in their manual that we'll have to look, but some of their products do and some of them don't. We can definitely look in the manual and I can send you some more information, but it really depends on what product it is because not all of them do carry it. See here. Just gonna see if I can take a quick look. Yeah, we might have to send you more information on that after because I don't see it here. Any other questions that you might have? No? All right, guys. Well, this was such a fun webinar. We are going to have this on YouTube. We'll send you out some more information. And if you have any questions about any of the things we went over today, feel free to reach out. You can email us, call us. Everyone in our office is an esthetician, so you can definitely get any of your questions answered. And if we don't have the answer, which sometimes we don't, we have the best reference ever, BiON. So we can just reach out to them. Andrea, their education gal, is amazing at getting back to us quickly. So please let us know if you're even struggling with a client in your treatment room and you're not quite sure how to treat them or what to do. We can be a resource for that as well. But we love BiON. I've had fantastic results. It is wonderful, as you know, to be a part of someone's skin transformation. It's very special when someone trusts us with their skin. So I think that BiON definitely provides the path for success when it comes to acne and anti-aging. But please let us know if you have questions. I hope you have the best Monday and wonderful holidays if you celebrate. And if not, just a wonderful time and a great end of your year and a new, fun, happy 2024. So have a great day and we will see you soon. Thank you. Oh, and also there'll be I'm sorry, just pop in. There's going to be a survey at the end of this. If you don't mind filling that out, it helps me improve as an instructor and our education program here at Alexander's Aesthetics. I welcome all feedback and I look forward to reading it. Have a good rest of your day. Take care.